So whether it's speed, whether it's clinical quality and safety, artificial intelligence is really key to what we do. Amazon Pharmacy is using artificial intelligence in a lot of different ways to ensure that we're creating the safest, most clinically sound pharmacy in the country. And our efforts have been well documented. We actually had a Nature Medicine paper just published earlier in 2024, highlighting how we are using large language models, artificial intelligence to safely ingest prescriptions as fast as possible, to make sure we have provider intent as clear as possible, to make sure then ultimately we're delivering medications quickly and reliably on time. Artificial intelligence presents an amazing amount of opportunities for individual clinicians, including pharmacists, to reach more patients. So whether it's transcribing notes, whether it's making sure that we maybe auto-populated a response to a patient if they had a query on a side effect, whether it's allowing us to double-check our clinical intuition, make sure that, say, if we're determining what might be happening with a side effect, or ensuring that we've accounted for all drug-drug interactions, running that through an AI model to make sure that our clinical intuition is correct. That's an important double check, and it's going to allow us to reduce misdiagnoses. In the best case scenario, it's going to allow individual practitioners, pharmacists, providers, nurse practitioners to be able to spend as much time as possible counseling patients and doing direct patient care, less time doing menial work. The human element is still so important, and we're now seeing studies suggesting that artificial intelligence has such promise and potential, but that people still want, when it comes to especially health information, they still want it delivered in some fashion by a human being. We have to make sure that we're leveraging the very best parts of AI to, again, augment our clinical intuition, to make sure our processes are safe and effective. But over-reliance on AI as a mechanism to communicate to patients, that's where I would urge caution. Everything that we're doing at Amazon Pharmacy across clinical quality and safety, and to include making sure that we have our clinical pharmacists really lean into their education and practice at the top of their license, requires us to lean into artificial intelligence to make sure that we're as fast as possible across the country, to make sure that we're ingesting prescriptions into our ecosystem as safely as possible to really understand provider intent. And so it's a really key component of what we're trying to do to get, to really build Pharmacy 3.0, the pharmacy that we think patients deserve.